All right, so we're trying to look at blood disorders of pregnancy. That's like, it's more of like we're listing it. Okay, it's more we're listing it. So later now, everything we list here, we'll now discuss it in a different video. You get? So they said that blood disorders of pregnancy. Blood disorders of pregnancy. Now this is actually my favorite slide. If you want to actually know all the blood disorders of pregnancy, you could see the first one is what? Anemia deficiency linked. Okay, so what will be the potential outcomes? Bleeding disorders, what will be the potential outcomes? Then thrombocytopenia, that your platelet counts are going down. Of course, platelets are responsible for bleeding. You get? Platelets are responsible for blood clots. So platelet levels are going down, you know that there will be bleeding. Then venous thromboembolism, of course sometimes you have some hypercoagulation stuffs going on. You understand? That's just what happens. Okay, so that bleeding disorders during pregnancy, they can actually pose a significant challenges for both the mother and even the baby. So common conditions include, there will be anemia. All right, so anemia is what? Low blood count. All right, okay. Thrombocytopenia is what? Low platelet count. There's sometimes inherited bleeding disorders like what? Von Willebrand disease could also show up. So these disorders can lead to complications such as preterm labor, miscarriages, excess bleeding. All right, during delivery. Of course, you see it under the outcomes here. I told you guys that this is my favorite slide. If you want to understand this lecture, just pause here and look at this slide. So management often involves what? Specialized care, including you trying to monitor the blood levels, administer supplements or medication. All right, then you are trying to plan what? Planning for delivery at centers that are actually equipped to handle the cases related to that. All right, so the blood disorders include what? There's disorders of cellular count, that's a quantity, and also there's disorders of quality of the blood too. You understand? So common disorders of quantity is what? Red blood cells can be going down, that's anemia. Platelets can be going down, neutrophilia. All right, then what's the disorders of what? Quality. Okay, the shape of the blood can now be becoming so big. All right, that's what is known as what? Macrocytosis, neutrophilic toxic granulation, dull bodies, left shift, cytoplasmic what? Vacuolations, hypersegmentations, and giant platelets. So pregnancy is associated with what? Hypercoagulable state. You have a lot of blood coagulations here and there. You understand? So this is just it for the disorders. These are all the possible disorders that you could actually see in a woman that is pregnant.